Like and subscribe and click the bell icon to get new video updates.
China's COVID-19 lockdowns impact 165 million people. Here is what you need to know. China has introduced lockdown measures in its two biggest cities, Beijing and Shanghai, the twin engines that power much of the nation's economy, in an uncompromising bid to stamp out COVID-19 outbreaks. Shanghai is at the center of the latest outbreak, reporting upwards of 10,000 new cases a day. Authorities have responded with a citywide lockdown that has lasted weeks, confining nearly 25 million Albanian Lex residents of the once bustling financial hub to their homes or neighbourhoods. Meanwhile, Beijing officials have launched mass testing exercises, shut schools and imposed targeted lockdowns on some residential buildings in a bid to rein in infections. Those actions have sparked fears of a wider lockdown similar to Shanghai's. Throughout the pandemic, China has stuck to a strict zero-COVID strategy that uses lockdowns, mass testing, quarantines, and border closures to contain the virus. But the arrival of the highly infectious Omicron variant has thrown the sustainability of that strategy into question, with the virus spreading to different cities and provinces faster than the government can contain it. Authorities are now enforcing full or partial lockdowns in at least 27 cities across the country, with these restrictions affecting up to 165 million people, according to CNN's calculations. Here is what you need to know about the coronavirus situation in China. Cases in China began rising in March, soon spiraling into the worst flare-up the country has seen since the initial outbreak in Wuhan in early 2020. Northeastern Jilin province was hit hard during the early stages of the outbreak. Authorities put the provincial capital Changchun, an industrial hub, under strict citywide lockdown on March 11, with nearby Jilin City following suit on March 21. On Thursday, authorities in Changchun and Jilin City, which have a combined population of more than 13.5 million residents, said they would soon begin to gradually ease lockdowns, though it remains unclear what that process will look like, or under what conditions people will be permitted to leave their homes. Authorities also locked down several other cities, including the major economic center of Shenzhen, in March, though some of these measures have since been lifted. Shanghai, which has recorded more than 500,000 cases since March 1, introduced a staggered lockdown in late March. This had expanded into a full citywide lockdown by the end of the month. Some neighbourhoods can start to ease lockdown measures if they have reported no cases in the past 2 weeks, Shanghai authorities said on Wednesday, but it is a tenuous freedom, with the threat of reimposed lockdown if even one local case is detected. In Beijing, a mass testing campaign has covered nearly 20 million residents, about 90% of the city's population. Another round of citywide testing is planned for April 27 to 30. Targeted lockdowns in Beijing's Chaoyang district this week barred residents of 13 buildings from leaving their apartments, and residents of another 33 buildings from leaving their residential compounds. The capital closed schools in many of its most populous districts on Thursday. Several major hospitals also announced they were closing, and a growing number of entertainment venues including cinemas have also been ordered to close. Full or district-wide lockdowns are in effect in more than 24 cities including Hangzhou, home to 12.2 million people, Suzhou, home to 12.7 million people, and Harbin, home to 9.5 million people. They span 14 provinces, from far-flung northeastern Heilongjiang province to southern Guangxi and the mountainous western Qinghai province. Much of the Shanghai lockdown has been characterized by chaos and dysfunction, prompting alarm in other cities that fear they could be next. Many residents have complained of food shortages, lack of medical access, poor conditions at makeshift quarantine camps and heavy-handed measures such as authorities separating infected children from their parents. In March, an off-duty nurse in Shanghai died after being turned away from an emergency ward at her own hospital that was closed for disinfection. Last week, workers reportedly broke down the door of a 92-year-old woman's home in the early hours of the morning to force her into quarantine. These stories and many more have gone viral on Chinese social media, sparking rare outcry online. Similar stories have been reported from other parts of the country, too. In March, students at a locked-down university in Jilin City pleaded for help, saying they had been left to fend for themselves without basic supplies. Also in March, some Changchun residents reported struggling to receive medical care for non-covered diseases such as cancer or kidney conditions, with hospitals turning away patients. These incidents, particularly in Shanghai, long seen as